Aspirin, the world's most popular tablet. But many doctors are now saying stop. Why? Who should stop? Who should continue? Watch this video all the way through because a wrong decision could cost your life. For more than 50 years, the entire world looked at aspirin like a magic tablet. They said it would prevent heart attacks and break up blood clots. But in 2022, the American Heart Association, that is the world's largest cardiac organization, rewrote its guidelines entirely. So, what did the guidelines say? Do not take aspirin if you are over 60 and have no heart history. Why? Because aspirin can sometimes lead to serious brain bleeds and stomach bleeds. And for some people, that risk may outweigh the benefit for their heart. So the question right now is aspirin the right tablet for you or not? To decide that, there are three clinical scenarios. Only if your doctor confirms one of these three scenarios should you take aspirin. But before that, let me tell you who should stop aspirin immediately because this is very important. Number one, if you are over age 60 and have never had a heart attack, never had a stroke, never had a stent, you do not need aspirin. If someone had told you to take it and you have been doing so, please review this with your doctor. And number two, if you had a stomach ulcer or if you had bleeding elsewhere in your body, aspirin may not be your friend. Number three, if you are already taking blood thinners like Coumadin or warfarin or apixaban or rivaroxaban, adding aspirin on top of those medications may double your bleeding risk. So only take aspirin in this situation if your doctor specifically says so. If you are taking aspirin and if you fall into one of these three categories, please talk to your doctor immediately. Now, I will explain shortly how much aspirin dose you need and when to take it. If you haven't subscribed yet, please press the bell button to subscribe for this channel. Now, who should take aspirin and how much? Number one, if you have already had a heart attack or a stent in your heart or had a bypass surgery, you will need aspirin. Also, if you had a stroke in the past, your doctor may prescribe an aspirin. In these situations, you should take an aspirin 75 to 81 milligrams, depending on the country where you live. Number two, if you have peripheral arterial disease, meaning if you have blockages or plaques in the arteries in your legs or arms, or sometimes if you have carotid disease, which is blockages in the carotid artery in your neck, then your doctor may prescribe an aspirin. Number three, this one is tricky. We call this one a primary prevention, meaning you have never had a heart attack, no stent, or a stroke. But sometimes aspirin can be used to prevent cardiovascular disease before it happens. In this situation, here's what the doctor looks at. One, is your age between 40 and 70? Two, do you have diabetes, high blood pressure, or a smoking history or a family history of early heart disease? If the doctor thinks that you have a higher risk of cardiovascular disease, then they may prescribe an aspirin for prevention. But please listen carefully. This decision is made only based on your doctor's assessment. Do not self-prescribe aspirin under any circumstances. So let's summarize. To decide whether to take aspirin, ask yourself just one question. Has your doctor said any one of these three things? One, have you already had a heart attack, stent, bypass, or stroke? Then continue aspirin. Number two, if you had plaques or blockages in your arteries in your legs or in your arms or in your neck, which is called carotid disease, then you can take an aspirin after consulting with your doctor. And number three, if you're aged 40 to 70 years and if you have a high cardiac risk, then your doctor may prescribe an aspirin. If none of these apply, and if you are age over 60 without any cardiac history, stopping aspirin is the right decision for you. So, aspirin is not a miracle tablet, it is a double edged sword. In the right situation, it saves lives. In the wrong situation, it takes lives. So, think carefully, ask your doctor, and avoid self medicating. Thank you so much for joining me today. I'm Dr. Joseph Nyanraj. This is Dr. Logic 360, where your health becomes simple and smarter. Thank you for joining me.